Welcome to COVID Conversations. Today I'm talking about some of the mental health challenges that so many people are facing at this time. I'm talking to Dr Amy Langford about her work as a GP and what she is seeing and learning and doing.
So I guess we know it's a really difficult time for the community. Often people's mental health deteriorates if, say, you're under stress, you're physically unwell, you have financial strain, or you're socially isolated. And the unfortunate thing with COVID is it's a bit of a perfect storm where all of those things combine. People are socially isolating, they're not able to do the things that normally help them to feel better. You know, they might normally exercise, catch up with friends for coffee. They haven't been able to do those things. Plus there's financial strain, and it's a really stressful situation for everyone. No one has really faced this before. So we're finding that people naturally are really stressed, and where they might have had mental health issues before that were well treated or under control, that might have flared up, or some people where it's never been an issue before, all of those stresses has led to their mental health deteriorating.
What does a GP do when they meet with a patient who's got some mental health concerns? What's the process?
Yep, so often we are the first port of call, and I think the first thing is just listening and being there for the person. And often they might not feel comfortable to tell you what's going on straight away. And it might start with something more minor, you know, an injury or some sort of physical complaint. And then with time and trust, the person will often open up and let you know what's been going on. And so I think the first thing that a GP would do is to be there for their patient, to listen and to offer support, and then to find out what's been going on for that person so that you can work with them to work out what their goals are, you know, what the challenges have been, and how you can work with them to help them to feel better.
What might you expect if you go to a GP with some mental health concerns?
Firstly, your GP would talk to you and find out what's been going on, and then try and come up with a plan that works for the person around what are we going to do to help you feel better. And that might be simple things with your GP, like talking, simple strategies like exercise, planning pleasant activities, things like that. And then your GP is likely to add extra support. So that team really depends on, you know, the degree of difficulties that person might be experiencing. And it might just be someone extra to talk to, like a counsellor or formal psychology. So your GP can do a GP mental health plan that helps to subsidise seeing a psychologist. There are also mental health services available through the PHN that your GP can refer you to that are often free. And sometimes for a small group of people we might also involve a psychiatrist. So it's about creating that team.
And the options
Yeah,
that are
that's
right
right
for the person.
Yep, exactly what suits that person, and it needs to be individualised. It's not a one size fits all.
Yeah. Thank you. Thank you for talking to us, and good luck with the work you're doing. And thank you. See you next time.